Welcome to TTAKHIR Chanel. Fire in Rohingya camps, and the need for improved living conditions and healthcare facilities. On Sunday, a massive fire broke out in Camp 11, a Rohingya refugee camp in Cox's Bazar's Ukiah subdistrict, leaving thousands of people homeless. The fire razed at least 2,000 huts and other facilities such as a mosque, primary healthcare centers, help post, youth center, women-friendly center, child-friendly center, mental health center, etc. Camp 11 has 1.2 million Rohingya residents, and the fire quickly spread through the camp, eventually spreading out to camps 9, 10, and 12. Although fire and rescue officials have not reported any casualties, the region's hilly terrain made it difficult for rescue teams to reach and families to escape. While it is suspected that the fire originated from a cooking stove, the resident Rohingya people claim it was an act of sabotage. A report by the Bangladesh Army stated that over 27% of the 222 fire incidents in the Rohingya camps of Cox's Bazar between January 2021 and December 2022 were acts of sabotage. Local fire services and Rohingya refugees trained in firefighting had controlled the fire, and 16 UNHCR-funded mobile units were engaged in firefighting. In Ukiah, a 7-member committee has been formed to investigate the cause of the fire that occurred in the Balukali Rohingya camp in Cox's Bazar, Bangladesh. The committee consists of representatives from various agencies and is expected to submit the investigation report within 3 days. The fire affected 12,000 Rohingyas, for whom the International Organization for Migration will build temporary homes, while the United Nations agency WFP is providing emergency food assistance. The UN has provided mental health care services to the affected refugees, with 90 community health workers deployed to offer first aid and psychological support. The UN has also expressed concern about the lack of health facilities in the area, which are not sufficient to respond to the needs of 1.2 million people. Ukiah is a subdistrict of Cox's Bazar district in Bangladesh and is home to several Rohingya refugee camps. The living conditions of Rohingya refugees in Ukiah are generally very poor, with limited access to basic necessities such as food, water, shelter, and healthcare. The camps are overcrowded, and the shelters are often made of flimsy materials such as bamboo and tarpaulin, which are not adequate for protection. Many Rohingya refugees in Ukiah live in cramped, unsanitary conditions, which puts them at risk of contracting diseases. In addition, the camps lack adequate sanitation facilities, further exacerbating the risk of disease transmission. Access to healthcare is also limited, with only a few clinics and hospitals available to serve the large refugee population. Furthermore, the Rohingya refugees in Ukiah face significant economic challenges. Many are unable to find work, which leaves them dependent on aid provided by humanitarian organizations. The lack of economic opportunities also makes it difficult for refugees to access education, further limiting their opportunities for self-sufficiency and social mobility. Overall, the living conditions of Rohingya refugees in Ukiah are challenging and difficult, with many struggling to meet their basic needs. The situation is made worse by the fact that the Rohingya refugees are not recognized as citizens in either Bangladesh or Myanmar, leaving them stateless and without access to many basic rights and services.